Hi, everybody. I'm Dr. Ardis. This is the Dr. Ardis Show, and we're so excited to be with you today. This is a special presentation about a specific nutrient, a plant that contains a seed that has a miraculous, amazing, many health qualities. And I'm excited to actually educate you on what I've learned, what I'm excited about for you to learn, because this is actually creating drastic impacts in many, many people's health around the world when we introduce this to our audiences here in the last year or so. So we're very excited about it. The actual ingredient I'm going to be talking about here, the nutrient I'm going to be talking about, is the actual main ingredient in our BioDefense product here at the Dr. Ardis Show. So this product, BioDefense, is going to be sponsoring this presentation. But the very first ingredient in here, what we're going to be talking about, is a plant called Nigella Sativa oil. It also has another name called Black Cumin Seed Oil. I know you guys have heard me talk about this because it's been found to be an actual natural cure for the bird flu. It was even put in a failed vaccine for the bird flu. The failed vaccine was 25 million chickens got the shots and all died in 2008 and 2013. The same substance that we put in our BioDefense, the first ingredient, they put in those failed vaccines in 2013 and saved 91% of all birds from this poison or respiratory virus they called bird flu, H5N1, you name it. So anyway, you guys scared of the bird flu? You better have this. If you're scared of replicating venoms, proteins, plasmids, and the COVID-19 vaccines are still carrying long COVID symptoms, the problem is in the bowels and in your bloodstream. And the first ingredient in this product is why we're giving it away to people and why we're making it available to people, because we want you to have access to the nutrients that are research-backed and proven to actually be the cures for various poisons, pathogens, you name it. However, there's some incredible, amazing benefits of Nigella Sativa oil, Black Cumin Seed Oils, that for many of you, if you're not worried about those symptoms I just referenced or have fears of the clamoring, propagandized, coming viral pandemics, and you don't think you want BioDefense for that, the majority of this product is Black Cumin Seed Oil. And when you get done with this, you are probably going to be shocked. In fact, you might want to hang on, because this is the kind of stuff you're about to learn. If you think you don't want to pay attention to this, this one seed has oil in it that's been proven to actually increase the growth of mammals, birds. You can actually improve their immune system. You can improve and accelerate their growth rates. It's pretty amazing. That is just one of many, many things we're going to show you here that is published by the scientific community, by research scientists around the world, about the incredible benefits of Black Cumin Seed Oil, otherwise known to science and on product labels, if you see it, as Nigella Sativa, Nigella Sativa. All right, so here we go. We're going to dive into a PowerPoint presentation. Remember, you get the entire PowerPoint and this presentation at the Dr. Ardis Show underneath Patient Resources at our website. Now let's share my PowerPoint presentation with you. We're going to get started here. I'm so excited. I could not believe the incredible information we have put together for this presentation. All right, so let's get started. Here's the front slide. Why Dr. Ardis recommends black seed oil. Actually, this is why Dr. Ardis takes BioDefense that has black seed oil in it every single day. Remember, you can scan this QR code and get access to our newsletters, our announcements about new presentations, new podcasts coming out. Just so y'all know that's what that's for. You're used to seeing it. All right, so what is black seed oil? Black seed comes from Nigella Sativa, a small plant with pale purple, blue, or white flowers that grows in Eastern Europe, Western Asia, and the Middle East. People have used this tiny little black seeds of this plant as a natural remedy for the thousands of years. And they call it black cumin, the seeds. Black seed oil contains a substance called thymoquinone. You're not going to remember that, thymoquinone, which is an antioxidant and anti-inflammatory compound. Now, as we go along, you're going to see research studies that are actually abbreviating what they're testing as TQ, and that is an abbreviation of thymoquinone. So don't be confused when you see TQ, when you see thymoquinone, when you see NG for Nigella Sativa, when you see BCSO, that would be Black Cumin Seed Oil. It's all the same stuff. It's like coffee has caffeine in it. Black Cumin Seed Oil has thymoquinone in it. All right, so let's dive in here. Is black seed oil a secret health booster? Let's find out, says USA Today. Well, what did they say? What is black seed oil good for? Black seed oil is a source of omega-3 fatty acids, between 1.1 and 1.6 grams of omega-3 fatty acids, reports the USA Today. Black seed oil improves metabolism, weight loss, blood sugar, and cardiovascular health. All right, so you guys know I introduced this product, BioDefense, to help with bacteria, yeast, parasites, you name it, and the replication of venoms and proteins, you name it, poisons. And yes, we've educated you. I hope you haven't missed out on that on previous shows. Go watch it. But this is about removing pathogens from the body easily, successfully, and non-toxically. But did you know that black seed oil has this benefit to help cardiovascular health, improve weight loss, manage your blood sugar? So on Healthline magazine, an online medical journal, they have this article. What are the health benefits of black seed oil? And I'm going to highlight some of these. Just look at the list. Psoriasis, asthma, hair loss, and acne. All right, so any of you watching out here, let's say you got grandchildren, nephews, nieces, your own children, adult children, little bitty children. How many people do you know have asthma? How many people do you know are experiencing hair loss prematurely? How many of you know have acne as adults or teenagers? How many people are struggling with psoriasis? Well, just so you know, there's millions of them, so I know you know somebody with this issue. How many of you know that this product, black cumin seed oil, the first ingredient in my BioDefense product, can be applied topically for psoriasis, can be inhaled to cure asthma, I'm not joking, can be used to improve hair loss, reverse hair loss, and in 60 days can help reverse acne topically? Well, you're about to learn. All right, so here we go. It may reduce acne. A 2020 study found that using a topical gel made with black cumin seed oil extract twice daily for 60 days reduced acne severity by 78%. Could it help treat psoriasis? Well, in 2017, there was a review of all research studies on black cumin seed and psoriasis. They also found that combining oral black seed oil and topical forms of black seed extract reduces symptoms of psoriasis and improves skin lesions. Everybody you know, please yell at them, scream at them, pass this podcast to them, send them the link, buy the BioDefense, give it to them for Christmas, whatever. They need black cumin seed oil. Black seed oil promotes wound healing. They mentioned black seed oil contains a compound called thymoquinone, which then, when applied directly to the skin, may stimulate tissue growth and facilitate wound healing. Well, how many diabetic ulcers do you need to see before you start adding something proven to speed up collagen production and healing of wounds? The next statement reads, the oil seems to increase collagen production. Well, who doesn't want more collagen? It may support hair growth and health. Nigella Sativa extract lotion for 3 months significantly, they say, increased hair density and thickness in people with telogen effluvium, a common form of hair loss. Well, how many women out there are struggling with hair loss? You might want to try black cumin seed oil on the scalp or in a lotion. Black cumin seed oil may protect lung health and reduce asthma attacks. A 2020 review found a small study indicating that inhaled boiled black seed extract has a potential bronchodilation effect. It opens up the lungs for more air on people with asthma, improving all markers of lung function, not some markers, all markers of lung function and respiration rate, helping them breathe better. Well, how many of you knew that could help with asthma? It could also aid in the treatment of vitiligo. Now, this is awesome. I've actually read many studies on this, and we've talked about this in the past when I introduced BioDefense. But one study of 33 people with vitiligo found that twice daily skin application of a cream made with black seed oil improved pigmentation in the hands, face, and genital region after 6 months. Twice a day for 6 months. It also improved blood sugar levels. For example, in 2009, they found that black seed may improve multiple markers, including insulin levels, blood sugar levels during fasting, and after eating. All right. How important is this product and how amazing is this product? You're learning right now it's not just for infections. I'm learning it's not just beneficial to infections. God put this on the planet, this black cumin seed oil and the Nigella Sativa plant, to provide a nutrient that helps protect against blood sugar imbalance, wound healings that won't heal, cardiovascular health issue, asthma, and helping you breathe. This is incredible. Psoriasis, vitiligo. What's vitiligo? Just for reference, I want to go back and make sure y'all got this. Y'all know what vitiligo is? The first one on the screen? Vitiligo is where people lose the pigment of their skin. Could it reduce, black cumin seed oil, the risk of metabolic syndrome? Metabolic syndrome is 3 things: high cholesterol, high waistline, fat. You're obese, and you have high blood pressure. Those are the 3 things. One clinical trial involving 55 people with high blood pressure. Participants took 2.5 milliliters of black seed oil, like in BioDefense, twice daily for 8 weeks. At the end of the study, those who received the dosage showed improvement in different aspects. Most of them experienced, those that took black seed oil, reduced diastolic blood pressure. That's the lower number of your blood pressure that all cardiologists are so scared of. So you hear 120 over 80, that 80 number, if it's higher than 80, people get freaked out. Did you know BioDefense has something in it called Black Cumin Seed Oil that will lower diastolic blood pressure? It also, next statement, reduced total cholesterol, lowered LDL cholesterol, and lowered fasting blood sugar levels. Well, diabetics, you might want to get on black cumin seed oil. Benefits of black seed oil on Medical News Today. This is not Dr. Ardis's chiropractic blog. This is Medical News Today online. It says here, the benefits of black seed oil. They're publishing weight management. How many of you knew if you swallowed BioDefense twice a day in a capsule, it would actually help you reduce your BMI and your weight? A 2021 study on rats fed a high-fat diet also found that black seed oil may be able to help significantly decrease body weight and insulin resistance. Type 1 and type 2 diabetes can be reversed, and decreased body weight. Now, there's a term in that sentence I want y'all to focus on. This study, reported by Medical News Today, states it may significantly decrease body weight and insulin resistance. They didn't say it mildly did it. And this is very important. My audiences are going to get this. The word significantly, every time it is in a research study or in an article, the word significant is the most important term to look for in a research paper or medical journal or article. If they say significant, that means it had a massive proven effect to reduce your body weight and to reverse insulin resistance. What about skin health? Look, I just boxed it. Eczema, psoriasis, acne, warts are all improved with black seed oil, Nigella Sativa. What about wound healing? Cancer, they actually write, in 2022 study has shown that the thymoquinone in black seed oil can stop cancerous cells from replicating or metastasizing, or what they call proliferating, and may also induce death in those cancer cells. Oh my gosh. BioDefense for cancer, anybody? Black cumin seed oil is the #1 ingredient. All of you out there who are looking to prevent cancer, just so y'all know, everybody's body today, including mine right now, is making cancer cells, and my immune system is killing them. The people who develop cancer and they metastasize, your immune system suppressed and can't actually keep the cancer under control. That's why you would want black cumin seed oil and take BioDefense every day to help prevent outcomes like this. What about kidney health? Well, audience, I know my demographic is primarily an older generation for most people, and most of you are already being checked on a regular basis for kidney function concern. Many people in this country are on dialysis machines every week for years and the rest of their life. Many of them are on diuretics and Lasix to make their kidneys force them to pee. Let's talk about why it is I would recommend anybody who's concerned about their kidney health, their doctors reference their kidneys, or you're seeing a nephrologist or a heart doctor, you have got to be on BioDefense. Check this out. Research from 2021 has suggested that black seed oil can have a protective effect on the kidneys. Look at the bottom. A 2019 study also shows that black seed oil may be helpful in reducing the size of kidney stones and eliminating kidney stones from the body. Did you guys know that BioDefense at the Dr. Ardis Show could help with kidney stones? I actually had no idea until last week when I was gathering up these research studies to build out this presentation. Now, I want to thank my son Braden again for helping me put this together. We did it together. He did a lot of the heavy lifting, and I'm very proud of him. All right, hypertension. This was also exciting to me. A 2016 analysis found that black seed oil can help reduce high blood pressure. Well, how many cardiologists are telling your patients that they should consider black cumin seed oil or BioDefense from Dr. Ardis? No, what are they going to prescribe you? Lisinopril, enalapril, captopril, all made from snake venom. All ACE inhibitor drugs are made from that. Or they're going to put you on a beta blocker, or they're going to put you on those kidney drugs called Lasix or diuretics like hydrochlorothiazide, abbreviated on your pill bottle, HCTZ. All right, they also found that it reduced both the systolic and diastolic blood pressures. That's actually both numbers, black cumin seed oil. What about diabetes? Black seed oil may have anti-diabetic properties. It helps reduce a person's blood glucose, helps lower hemoglobin, and reverse insulin resistance. That's diabetes again, people. You might want to listen to the black cumin seed oil and the BioDefense. It's very important. Infertility. In 2014, males with infertility were found that black seed oil may improve sperm movement, increase sperm count, and semen volume. Thymoquinone can help boost the quality, motility, viability, and count of sperm cells per a 2018 study. How many people do you know are struggling to get pregnant, want to have a baby, and they're going to in vitro fertilization efforts, going to different clinics trying to figure out how many sperm they got, how fast are they swimming, are they moving at all, something wrong with them, are they swimming in circles and not straight lines, what's the issue? How many of you have ever heard that someone who was wanting to have a baby was told by a medical doctor at an infertility clinic, if you just took black cumin seed oil or BioDefense from Dr. Ardis, you'll see improvements in your sperm count, semen load, you name it. PubMed.gov. Let's dive into some research articles now and get out of the mainstream media news. These are researched, published articles reviewed by medical doctors and scientists confirming what they know about black seed oil. Watch this. Black cumin, Nigella Sativa, and its constituent thymoquinone in its review on its antimicrobial effects. What are microbes? Bacteria, viruses, yeast, and parasites. So this is able to handle a lot of those pathogens. Let's see what they discuss in this research study. Nigella sativa seeds have been used traditionally in Middle Eastern folk medicine as a treatment for various diseases for more than 2,000 years. Pfizer hasn't even been around 140 years, just so you know. No drug company's actually been around longer than 200 years. So this is way longer known to be effective. Black cumin seeds have a history of use in traditional Arabic herbal medicine to treat many diseases such as skin diseases, jaundice, gastrointestinal problems, anorexia, conjunctivitis, that's pink eye, dyspepsia, rheumatism, diabetes, hypertension, intrinsic hemorrhage, paralysis, amenorrhea, anorexia, asthma, cough, bronchitis, headache, fever, influenza, and eczema, just to name a few. This is what black cumin seed oil is being used. That's in our BioDefense every time you take it around the world to help with all of those conditions. Well, how many people do you know have any of those issues? Did you see paralysis on there? Why are you not all on black cumin seed oil if you took the COVID-19 vaccine shots and you're now paralyzed or had a trauma or injury? In this paper, we describe the antimicrobial effects of Nigella sativa and its constituents, showing the different extracts and by percentages of black seed oil and the microorganisms tested in experimental models. So this is what they are looking for. That's Nigella sativa in the middle, the actual plant and the flower. You can see here that it has anti-schistosomiasis benefits. That's a parasite. It's anti-parasitic, it's antibacterial, it's antifungal, and antiviral. Here's a table, and they're going to show you different doses that are collected from around the world from research studies of black seed oil. And what did they find was the result when they tested black seed oil around the world in each of these studies? What did they find it was effective against? On the right-hand side, for the next few slides, you're going to see where I boxed in red what are the bacteria, viruses, fungus, and parasites that were proven in that study to be cured by not antibiotics, by black cumin seed oil found in BioDefense. All right, look at the first one. This is a diethyl ether extract, you can see to the far left, of black cumin seed oil, and they wanted to know what is it effective against, and look what the results of the study were. They found that it was effective against gram-positive staph infections, gram-negative Pseudomonas, and E. coli. It also destroyed Candida albicans, C. albicans, that's Candida or yeast infections. They didn't find it effective against Salmonella, but they also found it effective against staphylococcal infection in mice. So staph infections, man, those are awful. Most people have their legs and arms amputated because they can't kill off the staph infection. You're learning here, black cumin seed oil in BioDefense. You should put it on topically on a staph infection and orally. The next study actually shows that it was, it says methanol chloroform extract and essential oil showed significant antibacterial activity against both microorganisms. You'll see right to the left, they were testing staph again and E. coli. E. coli is the bacteria they're using to make everybody who's vaccine injured developing worse and worse symptoms. BioDefense has black cumin seed oil in it. That's why we formulated it and released it. Let's look at the next list of what they found Nigella sativa kills. All tested strains of MRSA were sensitive to black cumin seed oil. MRSA, MRSA. In the case of staph, they found it also effective. Then go down lower, you'll find that it was effective against gram-negative bacteria also, which is like Klebsiella, Pseudomonas, E. coli. These are some of those examples. They also found a list here that it was found, you'll read the first one. Water extract versions were showed to inhibit the effect against Candida, vaginal yeast infections, anybody? Toenail fungus, anybody? Rashes or eczema or cradle cap on a baby, anybody? BioDefense, black cumin seed oil is a known cure. Now, this is very important. There was a book written by a last name Campbell, I think his name's Colin Campbell, out of Cornell University. And he wrote a book about 20 years ago titled The China Study. He went to China for 30 years and oversaw a study that lasted 30 years. And he took food to accelerate cancers growth and metastasize cancers in people, and then used other foods to reverse those tumors and cancer growth. What he used inside is found inside peanut butter to accelerate the cancer growth. He would feed them peanut butter, and inside of peanut butter is a fungus, a known toxic cancer-causing fungus called aflatoxin. Well, aflatoxin, check this out. You'll see the antifungal effects top left of Nigella sativa oil. The inhibition of aflatoxin B1 production by Nigella sativa oil displayed, sorry, it says here, we actually highlighted this. Aflatoxin B1, I just want to let you know, they found it had no effect on the growth aspergillus, but it did inhibit aflatoxin, and we're going to show you more. It's incredible. Aflatoxin is this known toxic fungus that causes cancer. I've never allowed peanut butter in my home after I read that book about 20 years ago. And every kid that came to visit at my home with my other kids spent the night. They'd always want to know, why doesn't your dad have peanut butter? Because peanuts contain an aflatoxin fungus that causes cancer, and it's published to do so. All right, so black cumin seed oil is also found to inhibit microgypsum, which is another type of fungus. And look at all the list of the various types of fungus. If you got a fungus, you should have this. Here's the antiviral and the anti-parasitic effects of Nigella sativa. It's the oil treatment, as you'll see, increased interferon production, which helps fight cancer. It helped increase the number of CD4 helper T cells, which helps increase macrophages, which if you watch Healing for the Ages, we showed you what macrophages are. They eat up all infections and cancer cells in the body. Then you'll see the next study, when they gave the oil administered for 3 months at a dose of 450 milligrams, you will see the oil significantly improved hepatitis C virus viral load. Well, who's told you that? If your medical doctor hadn't told you that and they're worried about your hepatitis C being spread to other people, you might want to just start taking BioDefense every day, 2 capsules loaded with a dropper full of this stuff every day. And then last, you'll see improving the oxidative status in red blood cells and hepatocytes of infected mice on this screen. And then they found anticoccidial effects were seen with both treatments, but the more rapid antiparasitic effect was seen with the Nigella sativa oil emulsion. So they were testing multiple herbs and plants. They found parasites were killed the most effectively by Nigella sativa oil, which is black cumin seed oil. Isn't that exciting? So here you go. Here's a summary. The potential Nigella sativa in the management of NIV infection. So you'll see, look all the way around here. Antiviral, anticonvulsant. Did you know black cumin seed oil is proven to actually reverse seizures? It's an antioxidant, bronchodilation to improve asthma outcomes and hay fever and seasonal allergies. It's anti-inflammatory, and it helps improve and balance the immune system. Here's the beneficial therapeutic effects of Nigella sativa oil in hepatitis C virus patients in Egypt. 60 volunteers were with proven chronic hepatitis C virus were selected from admitted patients at the hepatology unit. Hepatology means liver unit at the Beni Suef University Hospital. The inclusion criteria, those 60 people they included, they had to have been diagnosed with hepatitis C virus and negative for HBV, hepatitis B virus. They can only have hepatitis C. So this is what they did. Nigella sativa seeds and Z officinale rhizomes, another plant, were purchased from the local herbalist in Egypt. The extracts were made into soft gelatin capsules, each containing 500 milligrams of Nigella Sativa and or Z officinale extracts. Group 1, they said, served as healthy subjects. Group 2, the hepatitis C virus, served as hepatitis C virus control. Then there was a third group called hepatitis C virus patients plus Nigella Sativa received a capsule containing 500 milligrams of Nigella Sativa extract twice daily. Group 4 was called HCV plus G. They received a capsule containing 500 milligrams of Z officinale extract twice daily. And Group 5 was HCV plus NG. Received a capsule containing 500 milligrams of each extract twice daily. So both plants were put in there. So when you see HCV in Group 3, that means they got 500 milligrams of Nigella Sativa oil. When you see HCV plus NG, that's Nigella Sativa oil and the other plant combined, given in 500 milligram doses every day to hepatitis C virus patients. What did they find? After 1 month of treatment with Nigella Sativa and or the Z officinalis ethanol extract, patients exhibited another significant decrease in viral load as compared to the hepatitis C virus control group. You can see here, you can see just how much virus per PCR testing, which has been used for decades, not to identify a respiratory virus, but to look for genetic material, which makes up the proteins of everything, including a virus or a venom. All right, so what you'll see here is HCV. After a month, you'll see what was remaining of hepatitis C virus is the bar. So as you go to the right, you will see the first big bar was just the hepatitis C virus patients. And after several months, they still had the same amount of hepatitis C virus. The next one is after a month or whatever the time period was, after they gave them the hepatitis C virus plus Nigella Sativa, Black Cumin Seed Oil, look how much lower hepatitis C virus is underneath the column titled BC with the plaid looking colors. When you go to the very last column, you saw an even better improvement with both Nigella Sativa and Z officinalis herbs in combination. So I just want y'all to see, they know that this plant is super potent at reducing viral loads in the body, even of viruses they say you're going to have for your whole life, like hepatitis A, B, C. All right, now they're going to continue here in this study reviewing this. The blood concentrations of AFP were significantly elevated in HCV control patients as compared to the corresponding healthy patients. They found AFP, whatever that stands for, was significantly elevated in the hepatitis C virus group and as compared to the healthy subjects. Now, in this study, you'll see what that actually means, but you need to lower this AFP level to actually see better outcomes for the patient. And they only saw it lowered when they gave them Black Cumin Seed Oil. And there you go. You'll see it again. Here's a chart showing exactly what happened to your albumin in your blood, total albumin, and other markers in your blood. All previously mentioned parameters, they note, were potentially improved following treatment with Nigella Sativa oil. And you can see it there. This is the part of the paper where they want to have a discussion with the audience or the reader. Chronic hepatitis C, they say, is a major global health burden with an estimated 160 million people having it. In this current study, administration of Nigella Sativa and the mixture of the two resulted in a significant decrease in viral load in AFP with a more potent effect offered by the mixture. And then they state, Nigella Sativa administration resulted in a significant decrease in the viral load with 16.67% of patients becoming blood negative for hepatitis C. I need y'all to listen to that. People are told you're going to have this for life. 160 million people are told they have hepatitis C forever. Read that statement. When they gave only Nigella Sativa oil, 16% of all those people, months later, they couldn't even find hepatitis C in their blood. That's what's called seronegative. That means they took their blood, ran it through a hepatitis C virus test, and it would not show up positive. Now, just so you know, if you're standing in front of a doctor and they took your HCV test and said you no longer had hepatitis C virus in your blood, you know what they're going to say to you? Even if you were taking BioDefense or Black Cumin Seed Oil, they would actually look at you and say you must have been diagnosed before. They would never admit the body was able to eliminate anything or reverse anything. Now, we're going to keep going. And 50% of the people that got Nigella Sativa alone showed a significant decrease in the viral count. Among these, 67% had cirrhosis and 33% had chronic liver disease. implying antiviral activity. Also, the anti-inflammatory, antiviral, and anti-cancer activities of Nigella sativa have been previously documented in various in-lab studies and in human studies. In conclusion, our findings suggest that the administration of Nigella sativa, black cumin seed oil, was safe, tolerable, and decreased the viral load and improved clinical conditions for all hepatitis C virus patients. Do you know anybody that has hepatitis C? You might want to put them on black cumin seed oil, because they found in this one study, almost 20% of everybody took it within just a few months. They never were even testing positive for hepatitis B virus in their blood. Now we're going to get to this toxic cancer-causing fungus called aflatoxin. Nigella sativa, black cumin seed, as a biological detoxifier in diet contaminated with aflatoxin B1. I've already told you where you get that from in your diet. Peanut butter is one of those places. Peanuts are another one. All right, so here we go. The summary of this study was, and there's not any other slides but this one for this study, a total of 600 7-day-old quail chicks, so we're talking about little birds, were randomly selected and put into 8 experimental groups, and it was completely randomized. Experimental treatments included 2 levels of aflatoxin B1. They were going to inject it into these little birds, the actual cancer-causing deadly poison. And they were going to do it at 0 and 2.5 milligrams per kilogram of body weight, and 4 levels of various amounts of Nigella sativa oil. And you see the amounts. Some birds are going to get 0, some are going to get 0.5, some are going to get 1.1, and others are going to get 1.5% of their diet would be black cumin seed oil. And they were offered from 7 to 35 days of age to quail chicks. So starting on day 7, they started feeding them Nigella sativa oil and tracked them up till 35 days old. Read the bottom. Nigella sativa oil increased LAB and SFB, but decreased the E. coli populations in the chickens, or in these chicks. So it killed off E. coli infection. This study revealed that Nigella sativa oil, as a detoxifier, could relatively attenuate, totally stop the negative effects of aflatoxin B in quails, which would actually cause them all to have cancer, neurological disease, and they would die. Isn't that amazing? Let's continue going. An active principle of Nigella sativa, thymoquinone, showing significant antimicrobial activity against what are called anaerobic bacteria. There are some bacteria that survive better without oxygen. You want to name one? How about salmonella? That's one. Doesn't like oxygen. You put oxygen in there, it dies. E. coli, it dies. These are anaerobic, means they don't like oxygen. They prefer a no oxygen environment. Thymoquinone, abbreviated TQ, as I mentioned earlier in this presentation, is the major active principle of Nigella sativa oil and is known to control many fungi, bacteria, and some viruses. To show, and this is what they write, thymoquinone showed a significant antimicrobial activity against anaerobic bacteria. And they write in their conclusions, thymoquinone controlled the anaerobic human pathogenic bacteria, which supports the use of Nigella sativa in the treatment of diarrhea in folk medicine. So anybody out there who's got a UTI infection, said it's bacterial, anybody's got chronic diarrhea or diagnosed with IBS-D, which stands for irritable bowel syndrome diarrhea, you might want to get on black cumin seed oil. Now, one of these anaerobic bacteria is called C. diff. How many babies and how many adolescents are so worried about kids going to playgrounds, play yards, kinder care, because they're worried that their kids are going to get C. diff? I want y'all to look at this. This is incredible. C. diff was the most sensitive among the anaerobes tested, with intermittent sensitivity to black cumin seed oil at 10 and 20 micrograms per milliliter, and was completely sensitive, meaning it completely died. C. diff did in the presence of 40 micrograms of black cumin seed oil. It is dose dependent. If you took BioDefense and you have a bacterial infection or you have C. diff, I would do 2 capsules a day. If you don't see improvement in a week, 100% clearance, and you double it to 2 twice a day. Go up to 4 capsules. You'll see it's dose dependent. And so anyway, I just want y'all to know it works even with C. diff. Now, what you're looking at on the screen is they have a control, and then they've got the 3 different measurements of Nigella sativa oil in each of those little round circles that are brown. The control is they put C. diff, or the bacteria, inside the orange looking Petri dish, and just gave it food to eat, and it would grow. And you can see what it looks like. It actually has grown, and you can see there's a circle inside the orange circle. But then you will see, as you look to the right, to the first brown circle, you see there is a lighter colored circle, and that is the bacteria growing. As you go higher in dosage, left to right, orange to right is the lower dose. Then you go down from the right, bottom right-hand side is a little bit higher Nigella Sativa. The one on the bottom left is the highest dose of black seed oil. Watch what happens. You will never see any growth or rings growing inside of that bottom left actual dosing. So you'll see here, this is over time, over time, over time. And you can see bottom right, you'll see an continued growth or spread of the actual candida. It looks like a shiny cover on the top, bottom right of each of these images. And these left to right are over time. You'll notice never will you see any growth of any C. diff bacteria in the bottom left Petri dish of every picture. It was 100% effective at killing C. diff. Then they wanted to measure how does this actual compare to the ability to kill C. diff and other anaerobic bacteria. How does it compare to the most common antibiotic drug used to treat C. diff and these other types of bacteria? So I'm going to read this to you. They were comparing the two, black seed oil and this antibiotic, against C. diff and other anaerobic bacteria. The results of the antibacterial activity of various concentrations of metronidazole are given in Table 2, which reveal that C. diff was again the most sensitive to metronidazole. And just so you know, you will see that C. diff, the bacteria, would die faster with this drug than it did with black cumin seed oil at a lower dose. So before you get confused and think, man, I should just take the antibiotic, I have to show you black cumin seed oil doesn't have any of these things I'm about to show you. I looked up this drug, which they're trying to convince you here, and show you that it is more effective at killing C. diff faster, even though there is a dose of black seed oil that kills all of it. I want to show you what you don't know about this metronidazole. In their conclusions, I'm going to show you this after this conclusion here about the antibiotic. Thymoquinone, the most abundant active principle of Nigella Sativa, was shown to possess a reasonable activity against anaerobic human pathogens or bacteria, viruses, funguses. Thymoquinone was particularly more effective against C. diff. Regular use of black seed could prevent infection from C. diff. The study also supports the use of black seed in the treatment of diarrhea in folk medicine. Now let's go look at this drug they wanted everybody to see. This is metronidazole, and they're prescribing information on drugs.com. I want to show you this. Did you know that metronidazole has been shown to be carcinogenic in mice and rats? And I have to remind the audiences, I've shown you this over and over and over. When they study chemicals and drugs in mice and rats, those research scientists say the reason we test all drugs in mice and rats is because whatever happens in the mouse or rat is going to happen to the human, because we have all the same genes in order that mice do. So when they tell you this, that metronidazole has been shown to be carcinogenic in mice and rats, if you're ever wondering why so many people are being diagnosed with cancer, you're being prescribed drugs that are known to cause cancer. And if it happens in a mouse or in a rat, your medical doctor is going to say, no, that's not true. No, it is true. Research scientists say it over and over and over. The reason why we study rats and drugs in rats and mice first is because we want to see what happens to the rat or mice, because we know it's going to happen to the humans, which are just bigger mammals. We have all the same organs, all the same genes that every mouse and rat does. In fact, you have every single gene, every single organ that every mammal on Earth does. And that might seem weird, but if I cut open a blue whale, they have every single organ you do. But they swim in the ocean. But they have to come up for air just like you do because they're a mammal. All right, so here are the warnings on drugs.com for all medical doctors to know. You better look for these warning signs. Encephalopathy and peripheral neuropathy, brain swelling, and all of your legs and arms burning pain. Okay. That is a central and peripheral nervous system side effect of this antibiotic that they say is faster at killing C. diff, faster, but black cumin seed oil can prevent it altogether and cure it altogether. Let's read these statements in case you're wondering if you want to use that antibiotic. Cases of brain swelling and peripheral neuropathy, including eyes neuropathy, your optic nerve that controls vision, including optic neuropathy, you know how painful that is in your eye, have been reported with this drug, metronidazole. Encephalopathy means brain swelling up against the skull. Encephalopathy has been reported in association with brain toxicity characterized by ataxia, you can't breathe, dizziness, and dysarthria. Peripheral neuropathy, mainly of the sensory type, where you have pain, you can feel it, has been reported and is characterized by numbness or paresthesia, paralysis of an extremity. Paresthesia is where you can't feel anything on your skin. Now read the next one. This antibiotic for C. diff that they give to kids and adults. Convulsive seizures have been reported in patients treated with this drug. Do you know what has never been reported to cause seizures or convulsions or peripheral neuropathy or brain swelling? Black Cumin Seed Oil and BioDefense. Now look at the next one. I didn't even highlight it, but aseptic meningitis. Do you know how deadly meningitis is? Meningitis is an infection of the brain and the spinal cord. That is a published side effect of this drug they give to people with C. diff, when black cumin seed oil is already proven to be just as effective or better and safer. Then they're going to go and introduce you to the benefits of black seed oil in lymphatic tissues. So this is a study about poultry, birds. Response of lymphatic tissues to natural feed additives like curcumin and black cumin seed oils in broilers, a type of chicken, I guess, or bird, against Pasteurella multocida, some kind of bad bug. So this is what they did. We used the one-day-old Arbor Acre broiler as experimental birds. And in this study, we used the clinical strain of an infection called P. multocida. This was the design of the study. They took 100 one-day-old chicks. They divided them into 5 groups of 20 different birds. 1, 2, 3, 4, and 5 equals 100. 5 divided by 5 times 20 is 100 birds. Group 1 was served as a non-infected, non-treated control group. So they just left them alone to do anything with them. They want to watch them for a certain period and make sure what does normal look like. Group 2 was challenged with the infection with a dose rate, as you'll see, at day 28 of birth. Group 3A was offered Nigella Sativa oil at 2% in powder form in their feed from day 1. They were not given the infection, while Group 3B was also given Nigella Sativa oil at 2% in powder form in the feed from day 1 and was injected with the bacteria called P. multocida at day 28. Group 4 was divided into 2 groups also. Group 4A was given C. longa, another infection, 1% in powder. Oh, sorry, that's not an infection. That's an actual, that's the other plant they're using. And what was it called? Oh, sorry, curcumin. Oh, I couldn't draw the C out of my brain. So curcumin at 1% in powder form in the feed from day 1 and not given the infection. And then Group 4B was offered curcumin, 1% in powder form in the feed from day 1, and was then given the infection on day 28. Group 5 was also divided. Group 5A was offered both Nigella Sativa oil and curcumin in powder form in the feed from day 1. And Group 5B was offered both Nigella Sativa oil at 2% and curcumin at 1% in powder form in the feed from day 1, and then was given the infection on day 28. The test was performed at day 14, 21, 28 of the age of the flock to evaluate the immune system's effects of Nigella Sativa oil and curcumin in trail poultry broiler birds. And you can see the chart there. So there's the groups. You'll see what they did. You'll see where they measured at day 14, day 21, day 28. There's the days in which they did this. I'm just making sure you can all see this because this is going to be saved as a PDF on our website underneath patient resources. For all the scientists out there and research scientists that love reading those charts, this is the most important thing for our audiences, though. The Nigella Sativa curcumin and combination of both Nigella Sativa and curcumin in powder form were given in the feed from day 1 to all groups. After challenging some with this infection at day 28, most of the birds from Group 2 show depression and poor feed consumption. And within the first week after infection, the birds of Group 2 showed severe type of clinical signs such as fever, anorexia, ruffled feathers, mucus discharge from the mouth, white diarrhea, arthritis, and reduced feed consumption. All that group was given was the infection. The number of birds died from group 2 was 3.2 and 3 at day 37, 39, and 40, respectively, but most birds of groups 3, 4, and 5 were showing activeness, started feeding, and getting towards recovery. They were the ones given Nigella Sativa oil. Group 1, control negative group, no feed plus no infection. Group 2 served as a positive control after giving the infection. They all died, as you just read. Group 3 got the infection. Group 3B got the infection and Nigella Sativa oil only. The morphology or the disease state of the liver is normal. The spleen section of all cells is normal. The lungs of all cells are normal. So the infection didn't make it into the spleen, liver, or the lungs. Group 4B with curcumin, the liver section represented a mild congestion and mild fatty change that is different than Nigella Sativa oil. Nigella Sativa was better. And then spleen section represented a mild congestion and lung section represented a mild congestion. So curcumin was not anywhere near as effective at keeping the lungs, spleen, and the liver healthy as black cumin seed oil was. Isn't this amazing? Group 5B, when they gave both Nigella Sativa and curcumin, the normal liver section, spleen section representing a normal section, and lung section representing a normal section. As long as Nigella Sativa oil was going into the birds, they're totally healthy. Their spleen, their liver, and their lungs. Just so you know, you have a spleen, you have 2 lungs, and you have a liver just like these birds. There's pictures of what it looks like, what happened when the infection went into group 2, and the massive problems that you see in the liver slides. Group 3B, group 4B, group 5B, and you guys can go through these at your leisure if you want to download the PowerPoint. And these are the summaries. I just gave it to you. I'm not even going to read it, but it is there for your reference. Black seed oil was effective at destroying the infection and protecting all the organs. Antimicrobial activity and wound healing effect of a novel natural ointment in a lab and inside your body. 2 different studies. This study aimed to investigate the effect of an ointment based on Nigella Sativa oil. This oil had remarkable antibacterial activity against staph infections, E. coli, Acinetobacter baumannii, Pseudomonas aeruginosa, and in the body results showed the ointment significantly accelerated all wound healing and increased collagen deposition compared with the control. It was proven black cumin seed oil successful and diabetic wound healing was rapid. It also was proven to be, this ointment could be a suitable candidate for wound healing. Did you know that black cumin seed oil in BioDefense is also anti-HIV? Holy moly, I didn't know that. But anti-HIV activity of 8 monofloral Iranian honey types. So they took bees that were making honey and the bees that were collecting pollen from the Nigella Sativa flower. Watch this. This is fun. They're going to test the honey from various beehives that primarily only get pollen to make honey from specific flowers. So singular flower honeys from 8 floral sources were obtained from 3 different centers in Iran. Petroselinum, Nigella sativa, Citrus sinensis. These are different plants. You're just going through the list. There's the different plants they used. You just saw Nigella sativa also. And then they tell you that there was 4 singular Iranian honeys isolated, and that included P. satium, Nigella sativa, Z. multiflora, and Z. maritiana. Were separately dissolved in 5 milliliters of methanol and fractionated or separated separately. And you'll see that. Read the sentence at the bottom. This is awesome. Fractions 10, 12, 14, and 19, respectively, from Nigella Sativa oil have been demonstrated to have potent, not mild, potent anti-HIV activity and analyzed by NMR. So I just want y'all to know, if you think there's nothing you can do for HIV people, you should get them to BioDefense and make sure they have it, because black cumin seed oil or just black cumin seed oil by itself. Here's its antiviral activity, anti-HIV-1 activity of 8 different honey types, and their fractions were studied via this antigen kit. Each concentration was tested 3 different times. And they found those same fractions were the ones that were the most effective at reducing the viral titer of HIV-1 DNA. Honey originated from these 4 plants, inhibited viral replication. The effective concentrations of this honey types, including Nigella sativa, to be reducing the viral titers of HIV was by 50%. It were these fractions of 37.5, 88, 70, 88, 105, and 5 micrograms per milliliter, respectively. You do not need to memorize that stuff. We just want you to know Black Cumin Seed Oil is flipping amazing. It even has replicating HIV benefits. It stops it from happening. Here's the chart. You'll see at the bottom the list of the different plants, and you will see 1, 2, 3, 4, fifth plant is Nigella Sativa, and you will see the lowered amounts at various concentrations on the key to the top right. You'll see 5 micrograms, 10 nanograms, 5 micrograms, 100 micrograms per milliliter of these plants, and you see just how effective this substance, Nigella Sativa, is at stopping the replication of HIV. All honey types are effective. I'm just going to skip this one because I want to make sure we fit this into a time frame that's acceptable for everybody. The average MFI value and frequency of CD19 lymphocytes, your white blood cells, were increased for the cells treated with Nigella Sativa compared to control, along with the other plant called Z multiflora. So Nigella Sativa oil increased white blood cell count to fight HIV, proven by itself. In the present study, honey amino acid content can play a role. It has a potent anti-HIV effect. This last demonstrated that Iranian honey types with high concentration of these types of Nigella Sativa and others might be good candidates for preclinical evaluation of anti-HIV therapies. And look up above. This substance in Nigella Sativa and others may block assembly of new HIV virons and maturation of the virus. Stops reverse transcription of the virus, which is how it replicates in your body, supposedly. Anybody with HIV or AIDS? Well, you know or love, make sure they get BioDefense. I don't know about y'all, but I find this stuff fascinating because this product and this formula that God put on this earth, this plant, has so many powerful benefits to help people around the world with all kinds of conditions. Now, what about tonsillitis? How many of you know children or adults who have had their tonsils removed or being told they have to? Did you know that Black Cumin Seed Oil and BioDefense actually reverses tonsillitis? Symptomatic treatment of acute tonsillitis, pharyngitis, sore throat, tonsils swollen. And they say this is the treatment of tonsillopharyngitis patients with a combination of Nigella Sativa oil and another plant called Phyllanthus neruri extract. Acute tonsillopharyngitis, in case y'all are wondering what that is characterized by tonsil or pharyngeal inflammation. Nigella Sativa extract containing Nigella Sativa oil and Phyllanthus neruri extracts has both anti-inflammatory and immune system effects. They are doing this to examine the effectiveness of Nigella Sativa oil and Phyllanthus neruri extract against 200 patients, 186 which were completing the study. They gave them capsules which contained 360 milligrams of Nigella Sativa oil and only 50 milligrams of Phyllanthus neruri extracts. They swallowed this orally 3 times a day, 1 capsule daily for 7 days. At the end of the treatment for 1 week, a significantly greater proportion of patients in the Nigella Sativa group than in the placebo group had their sore throat completely relieved. Sore throats, anybody? Nigella Sativa oil extract was also found to be safe and well tolerated in acute tonsillopharyngitis patients. Ask your ENT medical professional if Black Cumin Seed Oil and BioDefense is right for you. This study proved significant benefits of Nigella Sativa oil in the treatment of acute tonsillopharyngitis compared to the placebo. So if you got a sore throat, those are awful. They're painful. I don't like them. Black Cumin Seed Oil in 7 days was proven to be the most effective against those who did nothing. The effect of Black Cumin Seed Oil and thymoquinone on acute kidney injury induced by sepsis in mice. Remember, if it happens in a mouse, it happens to a human. There was a rapid increase in the number of COVID-19 cases worldwide, this study says. Some patients progressed rapidly with septic shock, which was eventually followed by multiple organ failure. And in patients, besides acute respiratory distress syndrome and acute heart damage, including acute kidney damage. Thymoquinone is an active plant quinone found in black cumin seeds that has antioxidant, anti-inflammatory, and immunomodulatory effects of thymoquinone against renal damage have been demonstrated. Black seed oil can protect the kidneys. Thymoquinone can promote burn wound healing by reducing inflammation. Oral administration of it can effectively mitigate renal damage. How many of you have been diagnosed with kidney failure, chronic kidney disease? Please, for the love of God, start swallowing BioDefense. I don't want you ending up on dialysis machines, Lasix, diuretics. They found in this current study, we established the model of sepsis-induced acute kidney injury in mice and investigated the effect of black cumin seed oil on sepsis-induced acute kidney failure. They took 48 8-week-old mice, divided into 4 groups, and they took Nigella Sativa oils TQ, and all surviving animals were killed after 48 hours and blood samples were obtained. What did they find? They observed a significant increase in serum BUN, bilirubin, urea, and nitrogen, and CRE levels in the group, not the Nigella Sativa group, than in the control group. But treatment of black seed oil significantly decreased or lowered bilirubin, urea, nitrogen, called BUN, and CRE levels. This is showing you, if you have been told that you have chronic kidney failure or you're in kidney disease, they're looking at your BUN number. And if it stays high, they say you have kidney failure. Did you know black cumin seed oil is proven to reverse it and lower BUN? The CLP group, which was a different plant, showed the infiltration of inflammatory cells into the kidney tissue, which could be ameliorated or destroyed by putting in Nigella Sativa oil with thymoquinone. Isn't that amazing? They gave it a plant, it hurt the kidneys, and then they took that same person and they put in it, or the animal, and put into it black cumin seed oil and it reversed it. This indicated that thymoquinone could suppress inflammatory cell infiltration into the kidney tissue in the CLP-induced AKI model, acute kidney failure model. So you'll see there's the control. You'll see thymoquinone. They're pointing at it, the group, and then you'll see thymoquinone plus CLP. Look how much less white stuff is in the second panel. All healthy kidney tissue, much more in the thymoquinone black cumin seed oil group. All 3 genes were increased in the CLP group mice compared with the control group. However, this increase was attenuated, stopped by the black cumin seed oil group. You guys can read this at home. It's really incredible. I would continue to read it. There's a lot of science in this one. This study demonstrates that black cumin seed oil has a protective effect against acute kidney injury. The addition of thymoquinone significantly reduced the blood CRE inflammatory marker and kidney failure marker level called BUN, alleviating the sepsis-induced acute kidney injury. They even induced kidney injury with this poison, and they could reverse it with black seed oil. Our study established that black seed oil contributes to the mitigation of sepsis-induced acute kidney injury. Ask your nephrologist if BioDefense or black cumin seed oil is right for you. Regulating pro-inflammatory cytokines, pyroptosis, and apoptosis related expression. These findings provide a new strategy to treat acute kidney injury. Imagine if they would have taken all the people they shoved remdesivir into their veins that developed acute kidney injury in 24 to 48 hours. Imagine how many lives would have been saved if your medical doctor knew about black cumin seed oil's ability with its component called TQ, thymoquinone, to prevent and treat acute kidney injury. Black cumin seed oil has also been found to actually be protective against West Nile virus. How about that? All y'all are reading about that. This is exciting. You don't have to be afraid. BioDefense, people. Bioweapon defense. Agricultural waste-derived compounds, flax and black seed peels, and their toxicological effect against the West Nile virus. I wonder what we find. The plants, Linneum, Usitinium, and Nigella Sativa seeds are being studied. 100 grams of the powder materials of each plant were successfully extracted. They made batches of 25 third N-star larvae were transferred to 30 small disposable test cups and treated with Nigella Sativa and with the other plant peel extracts at different concentrations of 50, 100, 200, 300, 400 parts per milliliter. Parts per million, actually. Experiments were repeated 3 times to make sure the information was correct. The extract average yield obtained by the extract from the agro-waste extracts of Nigella Sativa peels and the Linum Usitaceum peels prepared using solvents of different polarities. And you can see them there. Then they said the presence of biologically active components from different solvents, extracts of Nigella Sativa oil. We're going to keep going. They found the highest amount of Nigella Sativa oil in the methanol or alcohol group, and this is what they found. The insecticidal activity of flaxseed and black seed peels were evaluated against the late third instar CX pipiens larvae in the laboratory, an insect that destroys plants. If you look down at the bottom here, they found methylene chloride extract of black seed oil was the most effective at helping to prevent West Nile virus strains. 3 solvents were used. The results indicated that petroleum ether was the version of both black seed oil and, I do not recommend petroleum, black seed oil and flaxseed oil extracts, respectively, after 24 hours was the most potent. According to the results of the bioassay, the most efficient extract of the 6 used extract is the petroleum ether extract of black seed peels. So even compared to flax, black seed oil, once again, was more powerful at beating the West Nile virus mosquito infection than anything else. Don't be afraid of West Nile. You've got BioDefense. You don't have to worry about it anymore. Results of this study have shown that phytochemical compounds extracted from flax and black seed peels may be innovative and integrated visualization of bioinsecticidal. Can we spray this stuff in powder form on farms so that when the mosquitoes show up, it'll kill them? Thus, this study has set an alternate control measures against CX pipiens compared to synthetic insecticides. Instead of synthetics, they found the natural peels of black seed oil and flaxseed oil, black seed being the most effective, was able to beat the spread of West Nile. And there's your actual study's conclusions. Very exciting. Now they went to a lab and they wanted to see, what about human papillomavirus? This is the one they say in Gardasil shots for all teenagers and young people. They need to get an HPV vaccine when they turn 9 years old, boys in America, and 11-year-old girls in America. So they're going to test here to see, what about plantar warts and HPV virus? Plantar warts are warts on the palms of your hands and on the palms of your feet. They're going to study black cumin seed oil against plantar warts and anti-HPV effects. What were the results? A synergistic botanical blend was prepared with moringa, Nigella Sativa, and Musa acuminata at a ratio of 1 to 1 to 1. There's your plantar warts. The figure shows good distribution of the extract that imparts good loading abilities of the polymer mixture. What they found, after 15 weeks, the results significantly differed between the intervention and the placebo group in terms of wart size. I want y'all to look at the pictures. When they use Nigella Sativa topically, you'll see it 0 time, 3rd week, 6th week, 9th week, 12th week. But look at the 15th week. Anybody out there got warts? BioDefense, black cumin seed oil, put it on your foot, put it on your wart. Every day, do it twice, 3 times a day, and you'll watch this thing disappear. Now, this is a chart that's pretty amazing. You'll see at the top in yellow, Nigella Sativa. Then underneath that, you'll see these other words highlighted in blue rectangles. So from the Nigella Sativa plant, there are these components inside the black cumin seed oil that represent all the different components science has figured out are listed in blue. All the green little balls represent the identified targets in a human or in an animal that those blue components of Nigella Sativa interact with. That is a massive amount of receptors on every cell of the human body. There's almost no single pathway in the human body that isn't impacted or benefited from black cumin seed oil, which is why BioDefense was so important for me to get out to everybody and make sure you have it. It's been blessing my life, this combination, for years. I just had to get it to you. So just look, if you are a pathways scientist, if you are a chemist of any kind, if you are a physiologist or a microbiologist or a biologist of any kind, and you're studying pathways of infections, toxicities, poisoning, cancer, you name it, look at this list. Every single just about receptor in the human body and every pathway that's used in the human body to keep itself alive and healthy are impacted by black cumin seed oil. They even show you what it looks like and how it's structured, how it actually interacts with EGFR, amino acid binding. That's for all the nephrologists out there, the kidney guys. The chemical profiling of moringa and Nigella Sativa and Musa acuminata peels led to the dereplication of 49 metabolites. Metabolites are things that are left over in the human body that can be dangerous, that enzymes need to clean up, your body's got to get rid of. Nigella Sativa oils led to the dereplication of 49 metabolites. And that is incredible. So and they say here, the data, read the last highlighted sentence, the data indicated that this herbal mixture could be a future strategy to combat human papillomavirus infections. You do not need Gardasil. You need black cumin seed oil. You will see here also, they show you the lesions using moringa, Nigella Sativa oil, all in combination. You see 0, 3rd, 6th, 9th, 12th, 15th week, all resolving. Please don't play around with it. If you've got HPV and you've been tested positive for that and you're getting warts also or lesions on the skin, you can use black cumin seed oil or our BioDefense to handle it topically. Now, I mentioned at the very beginning of this show, did you know that black cumin seed oil was proven to improve growth performance, growth, immune system, gut health, you name it? But they've already done it. Here's the work. Here's the study out of Science of Food and Agricultural Journal. Broiler chickens were fed black cumin seed oil at 0, 5, 10, and 20 grams per kilogram of weight in their diet. The supplementation of black cumin seed oil resulted in a tendency to have to decrease feed conversion efficiency on days 28 to 42. They were metabolizing nutrients better with increased dose of black cumin seed oil. Black cumin seed oil. They didn't have to eat as much. Protein deposition in their thighs, so muscle mass in their thighs and breast, was increased. Well, that's important for chicken farmers. And nitrogen excretion was reduced by black cumin seed oil. So I want y'all to know, if you're wanting to build muscle, you should probably take in black cumin seed oil. Counts of total bacteria like E. coli and Clostridium were not affected by black cumin seed oil, they mentioned, but salmonella decreased with increasing dose of black cumin seed oil. So remember, if you get food poisoning, black cumin seed oil, salmonella is typically what you're being poisoned with. Antibody titers against Newcastle disease virus on day 35 increased, which is amazing. You need more of these with increased doses of black currant seed oil. Concentrations of blood sugar and triglycerides in blood were not affected by it in the chickens. They write here in their conclusion, the use of dietary black cumin seed oil may improve growth performance, immunity, and nutrient utilization in these birds and in humans. Potential benefits of the combination of black seed oil and zinc supplements to treat COVID-19. This is one of the last things we're going to talk about. Yes, if you still have long COVID symptoms, there's a reason we came out with BioDefense. Go get it. Nigella Sativa oil could be considered as a natural substitute that contains a number of bioactive components such as thymoquinone. Further benefits to use Nigella Sativa could be augmented with zinc supplemented. Notably, zinc has been proven to improve innate and adaptive immunity in the course of any infection, whether it's viruses or bacteria. Zinc salt supplement could also be enhanced with Nigella Sativa oil, as its major bioactive component might work as an ionophore, an assistant to allow zinc to enter your lung cells, which is the target cells of SARS-CoV-2, supposedly, pneumonia, influenza, RSV. Given those benefits, this review paper describes how Nigella Sativa oil in combination with zinc could be useful to beat COVID. Now, just so y'all know, I already wrote a book on COVID. It's called Moving Beyond COVID-19 Lies. I want you to read the highlighted sentence at the bottom. Both Nigellamine and thymoquinone from Nigella Sativa oil might be considered as a potential medicinally bioactive component to treat COVID-19 patients. If it was good enough for that, it's going to be good enough for everything else. Why a combination of zinc and black seed oil in this same paper could be an alternative to remdesivir for COVID-19. Well, it boosts the immune system against viral infections. It increases the proliferation and growth of all white blood cells that include neutrophils, natural killer cells, macrophages, T B cells, and T and B cells, and cytokine production. If y'all didn't watch Healing for the Ages 2.0, day 1, I showed you all these cells and how they function all by themselves to keep you healthy. Black cumin seed oil helps your body make more of them. This is our BioDefense product. I mentioned when we released this about a year ago that I believe this one product should be in everybody's medicine cabinet. You'll see here the first ingredient in black cumin seed oil is Nigella Sativa black cumin seed oil. The second ingredient is spearmint oil and peppermint oil. It inhibits cancer cell proliferation. It's been proven to be powerful enough to naturally eliminate and defend against bird flu. It helps kill bacteria, viruses, fungus, and yeast, and it's been proven to do so. All right, everybody, you know how we wrap up these shows. I'm Dr. Bryan Ardis. I'm so excited for you being here with me, spending time with me again. I hope this actual presentation has been helpful. I hope that you guys find that BioDefense Black Cumin Seed Oil is something you guys can have faith in, trust in if you are challenged with any virus, mosquito, bacteria, fungus, parasite, bacterial infection. It is massively beneficial. And you saw that chart of all the different receptors in the human body that are actually impacted positively by Black Cumin Seed Oil, the very first ingredient in BioDefense. You've listened to me long and love. I'm Dr. Bryan Ardis. This is the Dr. Ardis Show. God bless you all. We'll see you next week.